Namaskar. Welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Medhya Karma and we have seen the case that a child has a good grasping power but he doesn't remember it for a longer time. We diagnosed this patient that he requires chikitsa specifically on the smruti, and for that we have to consider the kapha dosh. So kapha saman gunadharma dravyas will be useful, no doubt, but I ask you which will be the specific guna indicated in this patient to pinpoint our treatment. So let us discuss this point in today's episode. Now, what is memory? Incidences happen daily in our life. They get stored in the brain, and when we want to express them, they come in our mind, which is called as smriti. Day by day, this gathering of the incidences automatically happens. Now, when we say the person has got a very good smriti or memory, what it means? It means that the number of collection of incidences in his smriti is good, and most importantly, the smriti has retained that incidences for a longer time. In our daily life, we always uh, tell to other that this incident was happened 40 years back, but still I remember it as it is. Mainly elderly people have this common sentence in their talk that the incident has happened 60 years back, 40 years back, but I still remember it as it is. It means as much as this longer time, for this longer period, that incidence has been retained in the memory. So which guna will be responsible or useful for this retention of the incidence in the memory for a much longer period? Now, when we go to travel, some trip, we arrange a trip and we have some amount of money with us, do we expend all this money in the first day? No. We consume it slowly. We consume it slowly so they can be useful throughout the trip. We retain them as much as possible so our whole journey will be successful and we will not have a lack of money. So what is the journey? Journey is yatra. Yatra means from one point to other. Okay, so that's why we call it Jivan Yatra, from birth to life, to death, sorry. So this is also yatra. So to have this yatra successful, we have to retain that money as much as possible for a longer period. In the same way, when we say that the incident has been retained in our memory for a longer period, so the guna which is responsible or useful, specific guna which is useful to improve the smrti is manda guna. What is the definition of manda guna? Mando yatra kara smrtaha. It slows down the degeneration process. It increases the longevity of the life. Hence, when we have some incidents in our memory, it is retained by Manda Guna for a longer time So we can say that this incident has happened 30 years back, 40 years back, but I can still remember it as it is. Not only in the case of memory, but in case of physical strength also, Manda Guna has the same action. For example, there is a 100 meter run. A boy runs fast and completes in say 15 seconds or 20 seconds, and another boy walks slowly and completes its uh, distance in say half an hour. Now results are the same. Both boys have reached the target. They have completed the yatra of 100 meters from starting point towards the end point. So results are the same, both have reached the destination and completed their yatra. But what is the difference between these two? The boy which ran fast, will have more energy which has been used because the actions were fast. And the boy who walked slowly, his energy has been preserved and less amount of energy was used. Similarly, in the case of Smriti also, this Mandaguna prevents the, what you can say, slows down the process of Vismruti. Is try to retain the incidences for a longer point, and hence for the Smriti, the specific guna, in my opinion, which is useful in the practice is Manda guna. Of course, the other guna which are Kapasaman are also useful, but Manda guna is a specific guna. Hence, when such patient comes to you, we must use the Medhya Dravyas which contain Mandaguna, and hence the drug of choice is Brahmi, Mandukparni, which are of Mandaguna, and they will be helpful for the patient to retain the memory as much as possible. Hope you understand this. When there is lack of grasping power, we have to think Vacha, Jyotishmati like Dravya, which will increase Sadha Pitta. When there is lack of memory, we have to increase the Kapha Dosh, and at that time, Manda Guna is to be considered at most. We will discuss the last case which I have put in front of you in the next episode. Thank you very much.